Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Colorado, and I offer therapy via Skype for the treatment of anxiety and depression, and for help with addictions, and also for help with emotional trauma and recovering from emotional suffering due to painful memories and also intrusive thoughts and OCD. These are some of the areas that I specialize in, and I offer online therapy through Skype for teaching you how to work with your emotions more effectively. So Skype therapy is a great choice if you are looking for an alternative to medical treatment for anxiety or depression. It's very unusual to need medical treatment for anxiety and depression. Of course, if you have some form of physical process going on that is causing anxiety or depression, then it's good to go to a doctor to get that checked out. But for the vast majority of people, what you really need are more effective methods of working with your emotions, and particularly working with reactive thoughts, which are the primary cause of anxiety and depression. The way that we become identified with reactive thinking, including beliefs. We tend to become blindly identified with thoughts, and this is a form of cognitive reactivity that has the effect of feeding anxiety and depression very strongly. So uncovering those patterns of habitual reactive thinking is really central to overcoming the root cause of your anxiety and depression. Medical treatment, such as taking medications, antidepressants or anti-anxiety medications, may produce a short-term relief from symptoms, but it does nothing to change the underlying cause of your anxiety or depression. For that, you need a form of psychotherapy that really works at that deep level, the causal level of your emotional suffering. So that is the focus of my Skype therapy sessions. I use mindfulness therapy, which is very effective for helping you break free from those underlying habits that cause your emotional pain. If you'd like to learn more about Skype therapy and the mindfulness therapy approach, do please contact me and ask any questions you may have, and we can schedule a Skype therapy session so you can begin to learn these very powerful mindfulness techniques for healing. And that's really the primary objective in mindfulness therapy, is to heal anxiety and depression, much more than trying to tolerate anxiety or depression, or trying to manage it, or trying to change your belief structures. We want to actually heal the underlying emotion directly so that you can re-establish more emotional freedom and restore well-being and happiness. So the primary way we go about healing anxiety and depression is by learning how to meditate on anxiety and depression. We do not meditate in order to escape anxiety and depression. Rather, we make those emotions the prime object of our meditation. So we're bringing full conscious presence to help those emotions heal. That is essential. And the first part of bringing full mindful presence to your emotions is learning how to stay present with them consciously without becoming identified, without becoming overwhelmed by those emotions, and without reacting to them in a way that simply feeds those emotions. So learning to be mindfully present with your anxiety or depression or emotional trauma is the focus of mindfulness therapy, and it's very, very important. When you get that relationship right, that internal psychological relationship between your true self, the observer, and the content of your mind, the emotions and the thoughts that we often refer to as your little self, when you get that relationship right, then healing happens very, very quickly indeed. One of the primary reasons why anxiety and depression persist is because those emotions become detached from our true self. They become isolated or abandoned. They become suppressed, and they are cut off from the one thing that will heal them, and that is your true self. That part of you that is able to be fully conscious, fully present, and respond with complete compassion towards your emotions. You have to look at the emotions as being like a wound that is trying to heal, but it cannot heal by itself. It has to have your conscious involvement, your presence, in order for it to heal. When you bring your true self into alignment with your emotional pain, then it will heal. And often that healing happens quite spontaneously as a direct result of that establishing that inner bond between your true self and your little self, those emotions. So there's lots to learn about, but mindfulness therapy is very effective and it works very well over Skype. So I teach almost exclusively over Skype now. Most people really like it. They like the convenience of Skype therapy. They find it very comfortable. And often it's the only way to get the kind of help that you're looking for. So I work a lot with people suffering from agoraphobia who are not able to travel outside of their home or very limited area. I also treat a lot of people with anxiety about driving, with highway phobia or some other driving anxiety that limits their access to therapists. But most people that come to me have a specific interest in mindfulness therapy, which is not so widely available, especially the particular form that I teach, which is quite different and quite unique. So if you'd like to schedule Skype therapy with me using mindfulness, you'd like to learn how to work with your anxiety or depression using mindfulness, then do please contact me and let's schedule a Skype therapy session. Thank you.